In today's video, I'm going to show you how to perform CPR, how to use an AED, and how to provide rescue breaths to an adult or a child victim who is suffering from sudden cardiac arrest. Whenever you see a person who's on the ground, you always want to think about your safety first. So is the scene safe? Look left and look right. Once you establish that the scene is safe, you're going to try to wake the victim up. Hey, are you okay? Are you okay? Be careful. I recommend tapping on both shoulders, not just one, because if this person had had a history of a stroke where one part of their body was weak, if I'm only tapping on one shoulder, they may not feel me tapping. So I'm really trying to stimulate them. Hey, are you okay? Once I realize that this person is not responding, I don't have to check for a pulse or a breathing right now. What I need to do is I need to get help. I need to alert others. If you're in the hospital, you're going to press that code button. If you're in home care or if you're outside in the public, you can scream for help, tell that person, hey, you call 911 and come back. Something else you can do is if you have your cell phone nearby, is you want to also go ahead and call 911 from your cell phone and put it on speakerphone. You have to get help. All right, so now that help is en route, 911 is going to be asking, hey, what's the emergency? Plus, I need to know what the emergency is because there could be multiple reasons that a person is unresponsive while still having a pulse, while still being alive. It could be due to diabetes, drug overdose, maybe they had an allergic reaction. It could be a concussion or a head injury. So I'm going to be watching for chest rise and fall for 10 seconds. If I'm a lay person, I don't have to feel for a pulse, but if you're a nurse, a doctor, a CNA, someone who's been professionally trained, you're going to feel for a pulse and check for breathing simultaneously, no longer than 10 seconds. So I have my 2 fingers on a carotid artery. It's in the neck area on the side nearest me. I'm also watching the chest rise and fall. 10 seconds. No pulse, no breathing. Hey, you also bring me the AED. Hand placement. Whenever you're going to be performing compressions, you don't want to compress on the throat. You also don't want to compress on the very center, the bottom of the breastbone. That's referred to as the xiphoid process. There is a possibility that we could crack ribs when we're compressing. If we don't compress deep enough, which for an adult or a child is 2 inches or 1/3, the side view of that chest, you want to bring it in 1/3 of the way. If you don't press deeply enough, you're not getting to the heart. We need to be this person's external heartbeat until we can get their heart restored again. So I'm going to put my hands in the center of the exposed chest. I'm going to lock my elbows and I'm going to press down straight. Our mannequins have feedback devices, so when we press down at least 2 inches, it clicks. It also has lights or indicators in the shoulder, which helps us to keep pace with our rate. The goal is 100 up to 120 compressions per minute. So with us being their external heartbeat for right now, we have to be faster than their heart because we're not going to be as effective. However, there is something called being too fast. So you don't want to compress too slow and you don't want to compress too fast. If you compress too fast, you don't allow the heart time to refill with blood. Notice that when I compress, I'm circulating blood. When I let my hands raise or recoil, I allow the heart time to refill with blood. So if you're going really fast, you're doing a lot of work, but you're not being effective. So we're going to go ahead and do a quick demo on just chest compressions. Interlock, hands in the center of the chest, lock those elbows. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. If you know this person, you can provide a rescue breath mouth to mouth. However, if this is a patient or someone who you don't know, I wouldn't recommend utilizing your mouth. What you do instead is compression or hands only CPR until those advanced rescuers come or until your teammates come who will have additional equipment. Fortunately, I happen to have a face shield right here. When you're utilizing the face shields, I want you to know that the face shields are designed to prevent vomiters from crossing. They're designed to prevent you from contracting herpes, but this filter isn't strong enough to prevent COVID from passing. So this is going to be an optional skill, but what you do with your facial shield is you would place it on top of your victim's face with the square, the venable area over the victim's mouth. So square to mouth, pinch the nostrils. If you don't pinch the nostrils, when you give your breath is going to escape through the nostrils. So we need to pinch those closed to force the air to go into the lungs. Now we have to open the airway. So it's going to be place, pinch, tilt to open the airway. Whenever someone is unconscious, their tongue collapses and it will block their airway. So whenever you do the head tilt chin lift, you actually move the tongue so that the breaths can go through. After 30 compressions, you would give 2 breaths while watching for chest rise. Each breath should take no longer than 1 second, and you have 10 seconds total before you have to resume your chest compressions. So let's practice again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, followed by 2 breaths. And you keep doing that until help arrives. For our scenario, help just brought the AED. So we're going to open up the case. Our AED just arrived to the scene, and if you've never used an AED before, they're super easy to use. They are voice guided. So even when you take it out of the packaging, it will automatically turn on. If you open the case, it may also automatically turn on. Worst case scenario, find the power on button, because once it is turned on, it will guide you through all of its processes. And let's demonstrate now. I opened the case. It didn't power on automatically, but I have a green button here. Let me turn it on.
Remove clothing from the patient's chest. Open packet and apply pads onto patient's bare skin. Apply pads as shown in the pictures.
So the pads
Open packet and apply pads onto patient's bare skin.
have a diagram or an illustration that
Apply
shows
pads as shown in the pictures.
how the pad should be placed.
Open packet and apply pads onto. Press pads firmly on skin. Apply pads as shown in the picture. Press pads firmly
Everybody
on
stand
skin.
clear. Stand clear.
Do not touch the patient. Analyzing heart rhythm. Do not touch the patient. Analyzing heart rhythm.
Stay back,
Shock
everybody.
advised. Do not touch the patient. Press the flashing shock button.
Everybody's clear. Press it
Press
on
the
3.
shock button
1, 2,
now.
3.
Shock delivered.
We can resume
Begin
compressions.
CPR.
So all of your AEDs that correspond to current guidelines should have that tone, which is referred to as a metronome. And you want to keep the pace.
30. Give 2 breaths.
And you continue doing that until the AED reanalyzes. And the AED is going to reanalyze every 2 minutes, at which time you want to say clear, Allow the machine to run its program. It's checking to see if the person has a shockable rhythm. And if they do have a shockable rhythm, you repeat the steps. Whenever it indicates, make sure no one's touching, you would press the shock button. There is no residual charge. As soon as the shock is given, you can return and start doing your high quality compressions or CPR, beginning with your chest compressions. It won't hurt if you leave this on the victim's face, but if you decide to take it off after you give your 2 breaths, you're more than welcome to do so. You want to monitor for signs of life such as eyes flickering, finger movement. If the person is responding, or if they start having signs of life, which if they start having improvements such as improved coloration, you can go back and feel for a pulse, even though this is still beeping, because the AED is only going to reanalyze every 2 minutes, and we don't want to be doing chest compressions if the victim has signs of life. Once they have signs of life, you keep the device on. And if you're in an area that doesn't have a hospital bed or a bed that can elevate, you're going to turn them to their side, because more than likely they might vomit. And if they vomit, we want to make sure that all the vomit does is able to clear their airway. Keep the device on until the paramedics arrive or until someone with more experience takes over. This is going to keep monitoring your patient, and for every 2 minutes, it's going to determine whether or not another shock is needed. We turn them to the side, which is the recovery position, because they regained a pulse. However, let's say we're on the phone and we're busy with 911 and the person loses their pulse again. All you would do is lay them back onto the ground, allow the machine to analyze, make sure that you're not touching when it's analyzing, and when it says the shock is required, you would press the shock button and go right back into your high quality chest compressions and CPR. All right, so my name is Nurse Eunice. I hope that this helps you. My goal is for you to be a caregiver who is not afraid to assist somebody in need. Remember, for every minute that you delay in starting CPR, the victim who's in sudden cardiac arrest loses 10% of their brain function. We cannot wait for the paramedics. Sometimes it takes the paramedics about 7 minutes to get to you. I need for you to know what to do until the paramedics or someone with more equipment, more experience arrives. You can literally be the difference between this person living or dying. So I need for you to learn these skills, practice them often, and really take your CPR classes seriously. All right, everybody, this is Nurse Eunice with Florida Training Academy, and I'll see you in the next video. Bye.